Okay, in this video we're going to talk about diagnosing diabetes, history and physical, right? Find out what's going on with the person. Find out, right, and so what are the signs that you'd be looking for? And I got those written right here on the board. Hopefully you can see that. Polydipsia, right? Polyuria and polyphagia. Polydipsia means that they're very thirsty all the time. Polyuria means they're peeing like crazy, right? And polyphagia means that they always want to eat, right? They're always feeling kind of hungry because their cells are asking for food, right? Usually the polyphagia, what they want to eat is usually like fruit and things, kind of some sweet things. Other signs, they're not getting glucose into the cells, so they're going to be fatigued and weak, right? Because they don't have that. Glucose is what we need to burn in order for the energy. So if they're not getting it into the cells, they're feeling weak, even though they are eating and ingesting enough glucose. That weakness and fatigue you could expect to be in their list of signs and symptoms that they report. And of course we'll be checking their blood sugars, and when I'm talking about blood sugar results, what I'm always referring to is the fasting blood sugar result, right? It's not just a random blood sugar on a person who hasn't been fasting. What you would do is you would check their blood sugar in the morning. You usually want them to come in because you want them fasting for about 12 hours before you check their blood sugar. Normal, we figure fasting normal, most recently that I've seen, they're calling it 70 to 110 is the normal range. So over 110, they're saying, okay, now it's high. You do not diagnose diabetes with one high result. You'd have to have a double, at least a second high result in order to say, okay, this person is diabetic. And we also may diagnose them as pre-diabetic, right? If they're like between 100 and 110, might actually your book says between 100 and 125. So if they're in that range, now you might think, well, wait a minute, 110. They said if they were over 110, that's high. So wouldn't they call that diabetic? And they might. But what we'll look at is, are we able to keep this in the high normal area, right there around that border, or in the lower part of the high result? If we're able to keep it in that area with just diet and exercise, they'll just call them pre-diabetic. So if they're like between 100 and 125 and they're not needing any medicine or anything, and you seem to be able to keep the results in that area along with exercise and diet change, they'll be called pre-diabetic. And then we also have the hemoglobin A1C result. Hemoglobin A1C gives us an estimate of what their average glucose level has been over the last 2 or 3 months. You wonder, well, how does it do that? Hemoglobin A1C is a type of hemoglobin that happens to adhere, that glucose sticks to a little bit easier than the other hemoglobins. But you got to remember, glucose sugar, it's sticky, and that's the good way to think about it, is that it's sticky, so it sticks to stuff real easy. Well, it'll stick to hemoglobin too, right? So in where is hemoglobin? I drew this, this is supposed to be blood vessel, and a couple red blood cells in there. And we should know hemoglobin is in our red blood cells, right? And we got this glucose that's always floating around. We got this glucose here that I just drew in green. So glucose will stick to hemoglobin. And it sticks, right? It's sticky stuff, so it sticks to the hemoglobin. We can look at the hemoglobin and see how much of this glucose is stuck to the hemoglobins, and it gives us an idea as to what our average glucose level is over the last 2 or 3 months. And the reason we go with 2 or 3 months is because red blood cells live to be about 120 days, and then the red blood cell dies. So they figure anytime you look at red blood cells, the average age of those red blood cells is about 60 days, right? Some of them are 119 days, some of them are 2 hours old, right? So, but when you average it all out, since they live to be 120 days, they figure right in the middle there would be about 60 days. Figure that when they figured out the percentage of hemoglobin that has glucose stuck to it, will give us a good average of about 60 to 90 days. I'm talking about the glucose sticks to the hemoglobin. Where is the hemoglobin? Hemoglobin is in our red blood cells. So this is supposed to be a blood vessel, and there's a couple of red blood cells in there. And I made the glucose is green. Some of it's in here. Some of it gets stuck to these here. Right? Each hemoglobin has 4 receptor sites on it. Some of them get stuck to it, and the A1Cs especially, the hemoglobin A1C. So what we do is we look to see what percentage of hemoglobin receptor sites have glucose stuck to them. And they've been able to figure out that an estimated average glucose level over the last couple of months by just seeing what percentage of hemoglobin has glucose stuck to it. And so what they figure is it should be about 6% or less of the receptor sites and the hemoglobin A1Cs, about 6% or less of those should have glucose stuck to them. More than that, you've had a probably higher than normal average. Less than that, you've had a lower than normal average. So actually 4 to 6%. But when we're talking about diabetes, we're talking about highs, right? So anything higher than that. Now, if you have a diabetic, what you're doing is you're hoping to control that glucose to a level where you keep the A1C less than 7. So you want it to be less than 7 for a diabetic. And a glycated hemoglobin means that it's got glucose stuck to it. And then what happens at 120 days, red blood cells die and the hemoglobin goes out and it gets recycled and then it's put back out there and it doesn't have anything stuck to it yet, right? But then over time it does. So you can look and see what that percentage is. If you start treatment, let's say I started treatment on somebody, you can expect their hemoglobin A1C to be better than, like 2 days later, right? Obviously, because they still have all of that same hemoglobin that's already been saturated before you started the treatment. So it takes about 2 or 3 months before you can really see how well the treatment is working if you're using A1C. Now, the fasting blood sugars, you can tell right away, right? Because you're getting a snapshot of what that blood glucose level is right now. It doesn't help over a long period because you kind of want to know. I mean, if you check it for right now, you can see what their blood sugar is this morning, but you wonder how have they been controlling it over the last 3 months. A1C will tell you that. This new treatment that we just started, is it bringing their sugar down? You need to get a fasting blood glucose on that to see how it's working right now. And then, in fact, I had a friend of mine ask me about it. They said, the doctor checked that hemoglobin A1C. He started me on a pill for my diabetes, and he gave me the hemoglobin. He checked my A1C a week later, and he said, well, it's a little better, but we can't really tell yet. We have to wait for about 2 or 3 months. And he said, I'm going to check it, and her follow-up, which was 3 months later. She said, does it really take that long for the pill to start working? And I said, well, sort of. It doesn't really take that long for the pill to start working. It's working right away, but it takes that long for us to be able to see the difference on your hemoglobin A1C because you've still got all the same hemoglobin that's already been saturated with glucose before you started the treatment. But after these cells start dying and being replaced with fresh hemoglobin, then we can look and see how many of these new hemoglobins end up saturated, and it should be a lot less than what you'd had saturated before you started treatment. And some other labs that you're going to do when you're doing a diabetes workup on somebody, you're going to get hemoglobin A1C, you're going to get fasting blood sugars, and you want to get a urine. You always want to get a urine because you want to see if they have glucose in it. Because the other videos I talked about how glucose is not supposed to be in the urine. It only is in there when you've had high levels and it's spilling over and going through the nephron and going out the urethra. I mean, normally it would all your glucose would get reabsorbed in the nephrons. There's one little formula that I want to show you. When you can take that percentage of hemoglobin that was saturated with glucose, and they've worked out a formula that will give you an idea of what the estimated average glucose would be, depending on that what you found for your hemoglobin A1C saturation percentage. And the way that formula works is you go 28.7 times your hemoglobin A1C minus 46.7. Right? In that formula, you work that out. So let's work one out here. Let's say that we had a result of for your hemoglobin A1C. Let's say we had a result of 6. So I'll take this out. Right? Now when you do that, you have to say 6. So 28.7. If I push the numbers all right, 28.7 times 6 equals 172.2 minus 46.7, and your answer should be 125. So if the person has an A1C, hemoglobin A1C result of 6, which we said would be normal for right, 4 to 6 is normal for a person who's not diabetic. So that means that their estimated average glucose over the last 3 months has been running about 125. Right? Now you can expect your hemoglobin A1Cs to be a little bit on the high side, and the reason for that is because it's an average. Right? Our fasting blood glucose should always be our low. Right? And then, right, you just ate a piece of pecan pie and boom, it jumps up to like 145, 150, and then it comes back down. So when you check the average, it'd be high. So I'd say that's probably about right. We're in the high average. We're a little bit high there because we say normal is 70 to 110. Well, normal for an A1C is 6. An estimated average of 125, it would probably put your fasting blood sugars would probably be down around 100 or so.